In my area of investigation in breast cancer, which is primarily the use of systemic agents to treat breast cancer, there are a number of new and exciting things happening. My own research area is primarily in the field of the use of hormonal agents or endocrine therapy in the treatment of breast cancer. In that regard, one of the big sea shifts that we see right now is that the early treatments of breast cancer were almost all hormonal or endocrine-based, and that dates way back to the 19th century. Somewhat more recently, the use of chemotherapies and their attendant toxicities and so forth have been used more and more. But what we're seeing now is a shift back towards emphasizing hormonal therapies, especially in those women whose tumors are estrogen and or progesterone receptor positive. And it may be that in many patients that have tumors like that, that the benefits of chemotherapy are either very, very small or potentially even non-existent. So I think it's really exciting that we're now moving back to history, if you will, and beginning to apply effective and substantially less toxic therapies. Well, I think that as patients approach the treatment of their own disease today, one of the challenges that they really have is trying to rapidly educate themselves because of the multiple different opportunities that they have for treatment of their breast cancer. And there isn't a single treatment or even 2 or 3 treatments today. The treatment typically involves the diagnostic radiologist, the pathologist, the surgeon, the medical oncologist, the social worker, the pharmacist, the oncology nurse, and many, many others. And so it's a real challenge today as a woman comes to the table to try to understand how the pieces fit together. And so I don't think we can tell them that there's a single 1 or 2 or 3 different choices that they have. It's usually a very long sequence of choices and decisions that they have to make. So the important component of that as a woman approaches her treatment is to realize that she does need to be educated as to breast cancer. At least most women need to be educated as to breast cancer. And that she should really insist upon a team of physicians, of healthcare providers that are used to working with each other, talk to each other, talk to her, help her make the choices as she goes through the process. One of my professional activities is that I'm very much involved in the development of treatment guidelines. These are documents that assist physicians and patients make decisions and appropriate decision choices as individuals go through their treatment. And one of the important things in developing those guidelines is to be sure that there is a multidisciplinary perspective, that all of the different physician groups, scientific groups that have ownership of this treatment, as well as the patient perspective, be reflected in these guidelines. And so one of the things that I find helpful about the American Society of Breast Disease is it truly is a multidisciplinary society whose mission is to educate and to advance the treatment of multidisciplinary therapy. One of the shifts we're also seeing in the society today, and we see it in the treatment guidelines also, is that we're now moving beyond being multidisciplinary, and we're moving into an arena that we call interdisciplinary, where the different specialists really have to interact with each other, they have to communicate with each other, they have to work together in a much more integrated fashion than we have historically in order to optimize the patient outcomes.